Hey guys, we're going to run through a quick video showing oral surgery instruments and what they're used for. As I say the names, I'm going to give a little pause so that you guys can repeat the names after me, and we're going to take a close look at the working ends. So let's go ahead and get started. As per usual, when it comes to these kind of procedures, it's going to depend on the dentist you're working with and how involved the tooth is as to whether or not you're going to use all of these instruments. But we're going to go through all of them just so that you have an idea of what they look like and what they're called. So we're going to start here by, this is called a scalpel or a blade. Sometimes it comes in two pieces. This one is like a disposable, and it's all already put together. If you are using a two-piece, you're going to want to use a hemostat right here where the blade clicks onto the handle to take it off and put it on so that you don't have to worry about cutting yourself. So this is used to flap the tissue before we get into removing an impacted tooth. Moving along, this is a surgical aspirator. Notice the end is solid. This is the only time you can get away with putting this directly on tissues. This is a retractor. Also the other thing that you're going to be handling, it fits nicely into cheeks and to hold tongues and stuff like that. So the first thing after we anesthetize, the dentist is going to do to make sure everything is numb is go to a periosteal elevator. You can see the ends of this are different shaped. One end is pointy and one end is rounded, so the dentist will take and stick this end into the sulcus just to make sure everything's numb and start breaking the fibers loose. Next is going to be just regular elevators. These come in different sizes and shapes and angles. Your dentist can be more specific, as to what they want as you're using those. So moving along, these actually four things are forceps, and these are the four basic styles. And one of you had a question last week about how you can tell if it's for upper and lower. So I'm going to show you by tilting down like this. You always want to start with a handle like this on all of them. And if the tip right here is pointed downwards with the handle bowed up towards the ceiling in the middle, then you know it's for the mandible. We go over here, see how the handle is bowed up towards the ceiling in the middle, and the tip is pointed upwards, so we know that's for a maxillary. Okay. These do have numbers. A lot of times the dentist will call them by their numbers. This one is a 151. This one is a 23. This actual one right here with this little hook in the handle is a 16, but the ones that are usually called cow horns, because when you look at the tip right here, it looks like a cow's horns, those are usually called 23s, as long as they don't have this little hook. And then we have right here is going to be a 150, and this one's a little smaller than the rest, so it says 150S on the handle right here. So I'm actually just going to go back over and just show you guys where the numbers are and what they look like. This one is a 33. This is for anterior. Some people call it a bird's beak. That's what I've heard it called. So once we loosen everything up with our elevators, we move along to our forceps. If the tooth breaks, we have to go in with a root tip pick, and that's what these little things are called. And you'll notice the tips of these are much, much smaller than a regular elevator. Once we get the root tip out, if we have broken bone, we're going to use a bone file, and you can see how it's shaped like a fingernail file, but it's made for bones. Once we smooth all the bone out, we're going to go in with a surgical curette, and you guys can see how this looks like a spoon excavator, and it basically is, but for a socket after you've removed the tooth to get any affected tissue out. Then this is rongeur forceps, or what these are called. And you notice the handle straight on those, so it can be used for the upper like this, or you can turn it over and use it for the lower. So after we get all the diseased tissue out, if we open it up with a blade, then we're going to have to sew it up with a suture. There are two different types of sutures. There is a silk, which you can see is written right here on this one. And the silk sutures have to be removed. So if you put one of those